Dr. Fanous, we see facelifts that have turned out well, others that have failed. What are the characteristics of a good facelift?
I would say the most important quality of a good facelift is when the result looks natural. What's important in a facelift is a result with a natural look.
Not to have a rigid or a frozen face.
That's right. It's not just a number of years that we can take off. If a person gains 15 years of youth from a facelift, but that person has a certain Chinese look or a pulled look, or the hair has moved too much back, etc., then it's not a good result, but actually a failure.
We should be able to recognize a person.
As well, the result has to be natural all over. The top of the face that goes with the bottom of the face, the whole thing has to look natural, as if the person has not been operated.
You have to respect the features.
Right.
People want to become younger. Well, up to what point can a treatment help?
The facelift can give you up to 10 or 15 years.
That much?
Depending on the technique and the case, I would say 10 to 15 years in average.
Does the result last for a long time?
It stays forever. That's a question that is often asked by patients, and I would like to explain it. Let us say that Madame Tremblay had a facelift that makes her look 10 years younger. So Madame Tremblay at the age of 50 is now looking 40. The 10-year difference will stay forever. Therefore, Madame Tremblay at the age of 100 would look 90. We keep the difference, but we continue to get older.
What exactly is a facelift?
A facelift is essentially a technique that pulls up the fallen tissues of the face and of the forehead. That is basically the technique of a regular facelift.
Is it considered a surgery?
Exactly.
People wonder whether it'll hurt or not. Is it a painful surgery?
In general, it's a surgery that does not hurt. There's certain discomfort, but not real pain.
You say it shouldn't hurt.
It shouldn't. There are different techniques, different facelifts. I use a technique called mini-surgery. It's essentially a technique that will give maximum results, but with minimum cutting. The fallen tissues of the face are pulled with a lot of special stitches and without having to cut all these tissues. The less tissues we cut, the less swelling and discomfort there will be.
So in the end, all depends on what technique
On the
is used.
technique and on the patient also, on his recuperation, on lots of factors.
Another worrying point, does it leave scars?
All surgeries leave scars. If we don't want any scars, then we should stay the way we are, without surgery and without scars. So there is a price to pay. Often, these scars are hidden. The important thing is that the scars should be somewhat hidden and not too apparent. I will give you an example. In the facelift, we can place the scar in front of the ear, or we could place it inside. It's obvious that if we do it inside the ear, there would be a scar, but a less visible one.
It is much less apparent. All is discussed with the patient before the procedure.
Exactly, and every doctor has his techniques and his reasons for choosing these techniques. So it's really between patient and doctor that advantages and disadvantages should be discussed.
In terms of recovery, can the patient return to work relatively quickly?
In general, it takes between 2 to 3 weeks maximum to go back to work and look